Hello, everyone. So in this slideshow, we're going to talk a little bit about toxic drug contamination and what exactly that means. So overall, we're going to talk about how you can stay safe and prevent harm from drugs that may have been tampered with or have something in it that you're unaware of. So a little more specific into what we'll be talking about, we're going to talk about what toxic drug contamination is, uh, what could be in your drugs potentially, how can I stay safe, what you can do if you see an overdose, and where you can also go to access more information as well. So what exactly is toxic drug contamination? So the definition that we put up here is toxic drug contamination is when drugs are mixed with other ingredients which can be harmful to your body. These other ingredients are usually added to drugs to make the cost of making that drug lower, but they can actually be more dangerous for you than the drug itself. Toxic drug contamination occurs in drugs that are not regulated, so drugs that don't come from a hospital or a pharmacy. These would be in drugs that would be purchased illegally. So our next topic is what could be in your drugs, or what could be in any drugs potentially. So we have some pictures up here to go along with them, but I'll go over some of these things that could be in the drugs that you could be using. So xylazine is also known as tranq or horse tranq. Opioids such as fentanyl, heroin, oxy, benzos or benzodiazepines. So that would be an Ativan, for example, or Valium. Stimulants such as meth, crack, Vyvanse, which is a prescription ADHD medication. And then there are also some other things that aren't drugs necessarily. Drugs can be cut with laundry detergent, with flour, with laxatives, which is a type of drug that makes you really need to use the bathroom. It makes you need to poop, or aspirin, which is another drug. So going into specifically that top category of drugs, so these are really common contaminants that could be in any street drugs, potentially. So xylazine is a type of medicine used to keep horses asleep during surgery. It is not meant for human use, and it can be very dangerous for humans. Opioids are a type of drug which helps get rid of pain and tends to make people very kind of calm and sleepy. Benzos are another type of drug which makes people very calm and relaxed. And then stimulants are the kind of opposite, where they're a type of drug that causes someone to be really hyper and energetic. And then a kind of important takeaway from this is any of these drugs can cause an overdose if they're contaminated in the drugs you're using, even if you have no idea that they're there. So with all this being said on how street drugs can contain lots of substances that could be dangerous, next we're going to talk about how you can stay safe and protect yourself. So we put up some key strategies to try and stay safe. These are important with any drugs that you're using at any time. They're always helpful to follow. So the first one is start low, go slow. So when you're trying a new drug, or if you just bought a drug, even if you've used that drug before, but it could be a new batch or bought from someone else, always start with a low dose and see how it affects you first. And then increase the dose slowly, even if you've had this type of drug before, because even if you've had that type of drug before, this could be laced with something that you're unaware of. So you always want to start with a low dose and see how it affects you first, because you never know what could also be in that drug that you don't know about. So the second strategy is always use with others. So when using drugs, always make sure to have others around you in case something goes wrong, so they can call for help. And just an important message with that as well is if you call for help for an overdose, you cannot be criminally charged or arrested for having and using illegal drugs or illegal substances. It is part of the Good Samaritan Act. And so you are able to call an ambulance or able to call for medical help without being in trouble yourself if you're responding to an overdose or what you think might be an overdose. And our last strategy that we put on this slide is only use one substance at a time. So when you're using drugs, only use one kind of drug at once. Different types of drugs can interact in different ways, especially because, as we've been talking about, you never know what could be in street drugs. It could have more than what you think is in there, and you don't know how it's going to interact with each other. So we always say use one substance at a time, and that is your safest option. Another great resource we have here in Kingston specifically is you do have the ability to get your drugs tested. They can test with strips for xylazine and fentanyl, and this all happens at the Integrated Care Hub. So if you're unfamiliar with it, it's on Montreal Street, 661 Montreal Street in Kingston. And so this drug testing kind of gives you a snapshot of what might be in the drugs that you're using, but it won't necessarily tell you everything. So you could take your drugs in to get tested, and they test negative for fentanyl because the piece that you're testing doesn't have fentanyl in it, but another piece of that drug could. So this is kind of a way to detect if there's anything in the drugs or try to detect, but it's not 100% foolproof. And so it's really, really important that even if you do go and get your drugs tested at the site, that you still follow those principles that we talked about of starting at a low dose and increasing slowly, using with others, and only using one substance at a time. But this is another measure you can take to get an idea of what might be in your drugs and how to use them safely. Another great resource that we have here in Kingston as well, also at the Integrated Care Hub site, so at 6661 Montreal Street in Kingston, we have a safe injection site. So if you're using drugs from your own supply that are drugs that are injected, so not drugs that are inhaled or smoked, you can use them at the site in a specific safe consumption spot, and where you are able to be supervised by peers and by medical professionals. And so they can act if something does go wrong. For example, if you were to overdose, they would be able to react and do something about it and provide help to you. An important part of these services is that they are non-judgmental. You can't be criminally charged for using drugs from your own supply at the safe injection site. This is a safe spot for you to do that. But you do have to have drugs of your own supply, and you also have to be able to use them on your own. You can ask for help from the employees and from the peers, but you have to be able to inject the drug yourself. So the last kind of big thing we want to touch on is what you can do if you see an overdose or you think that you see an overdose. So first, what exactly does an overdose look like? So it can look a little bit different in different people, and it depends on the type of drugs that they're using. But we could put some really keystone symptoms up here that are really important, especially for an opioid overdose. And so these are really, really important signs to watch out for. So if someone's especially drowsy, not being able to stay awake, they're having slurred speech, if they're starting to kind of go blue on their tongue, on their lips, on their nails, if they have very, very small pupils, so we have some pictures of all of those symptoms at the left there. So you can kind of see an example of what it looks like. They might have cold, sweaty skin. They might start to be really dazed and confused. And they could start to have kind of choking sounds and very, very slow breathing. And eventually, if this keeps going, they could not be able to wake it up at all, even when you're yelling at them or shaking them. and eventually they could stop breathing. So how can you respond to an overdose? So the first thing you want to do, so if you find someone who doesn't seem like they're conscious, or if you're using drugs and someone suddenly kind of changes in their behavior and they start to be really drowsy and lose that consciousness, these are some important steps that you should be following. So you want to check the person for any signs of response first. So try shaking them, shouting them. You can rub your knuckles on their chest because that will be painful. So if they are still able to wake up, then they'll wake up from that. So the next step is you want to, if they don't respond or wake up, you want to call 911. Or if they do respond and wake up and say that they're struggling and ask you to call for help, then it would also be appropriate to call 911 and get an ambulance to come. The next step is Narcan. So Narcan is a type of medicine that can be used to help reverse an overdose. So you may have it with you. We're going to talk a little bit about where exactly you can get it as well. So if you have Narcan with you, you want to remove the device from its packaging, place the tip of the device in the person's nostril, and press down on the plunger. And you can give this drug every about 3 to 5 minutes until that person wakes up or the ambulance arrives, and then you can tell them that you've been giving Narcan to that person. The next important thing is you want to make sure that they're in a good position. So we have a picture of recovery position up there at the top right, but some of the really important parts are you want them to be on their side, you want them to have their leg bent so that they stay on their side, you want to have their right hand supporting their head and able to keep that mouth open, and that because that allows them to continue to keep their airway open and breathe if they're able to breathe still. And this is really important because it's the best position in order to allow people to not only breathe, but if they do start to get sick and throw up, then it keeps them from choking on that as well. So another important part is report. So when the paramedics arrive, make sure to tell them everything. So how you found the person, how long they've been like this, if you know, like if you've been with them the entire time, and you want to make sure to tell them that you gave them Narcan as well. Before the EMS arrives, if you do know CPR and you're trained in CPR and first aid, and the person does not have a pulse and is not breathing, then you can follow the steps that you would follow to resuscitate someone according to CPR. But this isn't something that's necessarily accessible to everyone. We know that not everyone might have any training in CPR, and so these are important steps to follow even if you have no training. You can always follow these steps, and it will help the situation. So where can you go to access more information? So we put a couple of sites up there that are important. So the first one that we listed there is the Street Health Center. So it's located at 115 Barrack Street here in Kingston. So their services, they provide primary care services. So that would be type of thing that a family doctor would typically do. Hepatitis C treatment, opioid agonist therapy, which is a program for those looking to quit using opioids or lower the amount of opioids that they're using. They have a safe needle exchange, so you can bring in your supplies and exchange them for new clean supplies for injecting drugs. They provide Narcan, so you can go there and ask for Narcan or naloxone kit, and they will provide it to you free of charge. They're also available, as I'll mention, at the Integrated Care Hub, and they're also available at most pharmacies. If you ask the pharmacist for a Narcan kit, they will also give you one free of charge if they have them available. And then Street Health also does education and referrals to specialist services. And they're open from 9 to 4 every weekday, so Monday to Friday. And you can always walk in and ask for help. They may not have something readily available. It's not an emergency service. But if you are looking for any of these services, you can always ask them for help. They're happy to help refer you to the appropriate spot. And then the second place that we've listed there is Integrated Care Hub. So as I've mentioned it before, it's 61 Montreal Street. So like I said, they have a safe injection site. So that site is unfortunately only for if you're injecting drugs, not if you're like smoking or inhaling them. They provide the drug testing that I mentioned as well. They also provide Narcan or naloxone. It's the same thing, just different names. They also do primary care services and education and provide safe injection and inhalation kits. So again, those would be clean supplies in order for you to use those drugs safely. They provide safe sex kits, and they also provide referrals to specialist services.